Samueli Institute in Alexandria, Virginia, this is On Human Flourishing. I'm Dr. Wayne Jonas. Today we will be sitting down with Dr. Jean Watson, a thought leader in the science of caring. Dr. Watson founded the Watson Caring Science Institute and International Caritas Consortium, a nonprofit that created a model of caring for patients that is used in healthcare centers all across the country.
Caring science lifts science to a higher level because it's informed by a different worldview. It's informed by a unitary worldview where everything is connected, everything's in relation to everything else, which is the emerging worldview for the world, for survival. It also is informed by the deep ethic and the values of how do we sustain humanity, how do we sustain our planet, how do we sustain community. So the ethic and the deep philosophical orientation toward humanity, honoring the unity of mind, body, spirit, and understanding our relationship with our environment. The first starting point for caring, for human caring, is starting with self, of course. And how do we, align ourselves with source for survival and for expanding our connections with others in the world. So this alignment, starting with self, and you move in concentric circles out into the universe. And for healthcare, it's so important to see the alignment of human caring and meaningful relationships and values and purpose, meaning, connections, because that's related to healing, which is beyond medical treatment, as you know.
Right. So, starting with a worldview of unity, then is it fair to say then caring science is helping is the work necessary to help people see that unity and to align themselves with that reality? Is that? Yes,
that's a beautiful way to put it, because then if you go back to that quiet place of the inner self, you connect with source. Now, I've been using the work of Emmanuel Levinas to give a deeper meaning. He's a French philosopher, and he says ethics of belonging to the infinite field of universal love is the first principle of science.
So I think a lot of people resonate with caring, and we use the term care in health care. How do you put a science around this? How do you measure that? How do you define and measure it so that you know that it's there in healthcare?
Well, let me just back up a minute and say about the word care and caring, because it has been a slogan that's been trivialized. I've been using systematically the word caritas. And I use it very systematically. It's a Latin word, and it makes a deeper meaning of the purpose of caring in terms of the love, in terms of the connection, in terms of the deeper meaning of human-to-human authenticity. So from that perspective then, how do I measure this? How do we know it's there? I'm now working with a series of hospitals to authenticate. And I'm coming from the concept of human flourishing, actually, to say, how would we find new forms of evidence of authentic caring and healing and relationships within the current structure? So what I've been doing is working with the magnet criteria, and I don't know if those
this is the nursing
magnet criteria, and using those and then transposing those. They're more hospital oriented. And they're important because they've made a significant difference to all the transformation of healthcare in terms of hospitals. But we know the future is beyond hospitals. And we know now that many of the hospitals that are using like optimal healing environment, that are looking at some of the integrated medical principles and practices, that are using the caring sciences as a professional practice model for nursing, they're beyond the hospital model. They're already using these energetic caring healing modalities. They are preparing themselves before they enter the patient's room to bring up these feelings of compassion, using heart math methodologies to radiate this compassion and caring and love before they even enter the patient's room. They're doing a variety of almost rituals to sustain and to remind them of these practices. Some of the systems, these units that are doing these experimental projects with us, they do simple things like dimming the lights, having quiet time on the unit, I mean, just such simple things. And nurses and other health practitioners participating control this. They can do this. It doesn't require big, bureaucratic shifts. They just simply do those simple things. They put signs on the patient's door, quiet time between 1 and 2 or whatever it is, and no one's to be disturbed unless absolutely necessary, and it slows down their pace.
Yes.
They start their meetings with a pause, with an emptying out, with a coherent pattern to move into their heart before they start their focus on their work. They find they're more efficient, they're more effective, they get more done. In addition to those simple practices that are in a different consciousness, they're setting their intentionality in a whole different way. But we also have measurement tools.
Okay.
I have, from my original work of the 10 Caritas processes,
Right.
we have factor analyzed those down to 5.
Ah, really?
And the
Okay.
5 are asking patients, was your care delivered with loving kindness? Did you have a trusting relationship with your practitioner? Were your basic needs met with dignity? Did you experience a healing environment? And were your values and beliefs honored? Those simple things.
Those simple questions.
Now we're starting to explore whether just that one instrument alone might be some form of evidence of the patient's experience of caring
Right.
in relation to these new practices that are based on caring science.
I see. So on the one hand, one can follow this or track this or implement this by understanding a set of behaviors, including inner behaviors, your own intention and mental behavior, physical behaviors, as you've mentioned. You mentioned several of those. And then asking the patient about what they experienced, and all to try to fill out what does it mean to be practicing in a Caritas environment. if you
Exactly,
will.
right. Of course, ideally, wouldn't it be wonderful if patients would come into the hospital and ask if they have a Caritas practitioner?
You've mentioned several things that your average healthcare practitioner, your employee, others can do in terms of intention setting, in terms of pausing. Are there other specific things that our listeners could sort of take away from this, where they could say, boy, I could do that tomorrow when I go in to work?
But at the higher level, it requires a new consciousness. That's why I say theory helps to guide the nurse's practice, because theory, by definition, theory is theoria. It means to see things differently. It's the Latin word theoria. So to see things differently, then you can begin to do things differently. So then you can do these very intentional, conscious modalities. You can use touch very intentionally. You can use silence. You can use authentic listening without trying to respond right away. You can introduce the notion of healing touch, energetic touch. You can use simple cognitive measures such as aromatherapy, whether it's for yourself or being able to introduce that for patients. So it's a whole set of systematic practices, but in the 10 Caritas processes of my work, it's a guide for each one of these. So it's like systematic education, but it moves from giving information to coaching, working from the patient's point of view, their frame of reference, not your frame of reference. It means having rituals where you might have like hand washing. In one of my books, I talked about the zen of hand washing in a playful way, but now in a very intentional way. You use hand washing as such a basic thing that everybody's doing.
So it's a meditation or a preparation, not just washing the germs off.
Cleansing yourself and consciously blessing and releasing that last person or situation so you can be more authentically open to receive the next person. So the practice of authentic presence, of being in the now, and how do we do that in terms of our breathing and some of our pausing. All of this is a very basic centering that we teach in the hospitals that are doing this work. And this is what is making the difference, we hope, with the patients and the authenticity of the human-to-human caring relationship in a moment.
Right. So these are sets of skills that they can learn in the training programs that you provide in those areas. Who's doing this? What hospitals? Who's involved in
Well,
the
some of the
Caritas work?
hospitals are ones that are formally affiliated with us. Are Winter Haven Hospital, and it's now called Bay Care in Florida, Jacksonville Baptist in Jacksonville, Florida, Atlanta VA, Wake Forest University Medical Center.
What's your dream? What do you want to see happen? What do you envision in the future in terms of how Caritas and caring becomes part of our healthcare system?
Well, I would like to, or my vision is that hospitals of the future will become caring and healing systems for society, and they will move beyond the boundaries of the traditional medical treatment at all cost into really health centers for the community, and that you would have movements of practitioners will be in the community offering caring and healing modalities, extending. One of the hospitals recently, which is involved in their network, is St. Joseph's in New Jersey, and I was just there in May for their Nurses Week, and one of the things they had set up was a whole unit that was a spa. And it was like one room was visualization, one room was aromatherapy, one room was acupuncture, another was acupressure massage, and another one was kind of a quiet room for meditation. And that was for the staff. And the CEO of that hospital was so impressed with this that he said it's not just for Nurses Week, it will continue. But I said to them, now wouldn't it be nice the next turn to make that spa, or the spa model, open to the community?
Well, thank you very much. We have a whole group of folks from veterans hospitals coming in a few minutes here.
Right.
And looking for this type of thing, I think, and as well as some from the Defense Department and others.
Exactly.
And so I think that clearly your vision of the future is getting actualized as we speak. So
well, and yours as well. And Samueli.
It's a great honor to have you here and to work with you, and thank you for spending some time talking with us.
Well, it's mutual, and I thank you for your wonderful hospitality and your leadership in this world.
In an age of technological advancement and speed of light information sharing, it's easy to lose touch with the goal of modern healthcare, to support a flourishing society and the whole person. You can find links to topics we discussed today, including links to Samueli Institute's Optimal Healing Environment Framework in our show notes. This is Dr. Wayne Jonas. Thank you for listening to On Human Flourishing.